Great, thank you, Scott, and hi, everybody. Welcome to this webinar. I'm so glad you're here, especially fighting through the Zoom sluggishness, whatever that was about. So anyway, yeah, tonight I want to talk about change and embracing change. You know, we're in this kind of life seems like it, in one way, has slowed down since the pandemic, but in other ways, it just seems like it's going faster and faster. And so a whole lot of change. Of course, today we had a change in government, and just our lives seem to be one constant change after another. I think it's just kind of useful to go back and take a look at maybe how we embrace change. I think the first thing, from an addiction point of view, I think addicts probably hate change. At least I do. I'm a recovering addict, and I think I avoided any kind of change if I could help it. I think that was the first lesson I learned, is that change happens. Change happens. That's just part of what happens in life. And I think one of the mistakes we can make is kind of waiting to return to normal. And I think there's probably no going back with changes, and certainly going back to normal, whatever that is. So I think that there's kind of a mistake and error there in terms of how we think. Things may not be the same ever, but I think that's true of any change, where we change locations physically, or we change careers, or there's a change in our lives because we lose someone we love, or there's a separation in our marriages, or whatever that change may be. It's a loss of some kind. And I think that's always hard to feel, hard to deal with. So I think this is just a kind of review of some steps to embrace it, if not accept it, in terms of the change. And I think we can build kind of a personal resilience about this, and how we look at it. So a couple of tips, right? One is to really evaluate our level of control. I think at first, when we're in a situation that seems, especially if it's a crisis situation, everything seems overwhelming. Our lives might be turned upside down. Everything's topsy-turvy. We don't know quite what we think or feel or believe. And just life seems a little bit out of our control. Too many factors beyond our control that are influencing us. So I think it's really important to take a step back and see, well, what exactly can I control? What do I have in this? Where we may think at first it's totally overwhelming, there may be things that we, in fact, can control in the situation. Take the coronavirus, for example. I think there's a lot of fear about it, but we know there are certain things we can do. We can wear a mask, we can wash our hands, we can do social distancing and all that. With other changes, it may not be as obvious, the steps we can take, but there's always usually something we can take where we can start to plan. One thing I tell clients is that even if you can't really control the situation, we can get a kind of sense of control of ourselves by making lists of how we feel, or kind of writing or sharing about it, processing our own feelings, dealing with what it is. And we can take charge of that, and we have control over that to share what we're feeling, or write about it, or feel the feelings, let them out. So I think if nothing else, we can kind of validate our experience and live it and embrace that to the extent we can. And then take steps to deal with the situation. So I'm saying there may be things that at first are not as obvious in terms of what we can do, but I think there are steps usually that we have in a situation, once the dust settles, where we can start to get a better sense of that we may not be as powerless over something. And that's where the Serenity, of course, in the 12-step programs come in so beautifully, to really be able to evaluate what it is, can we change, and what do we really have to accept that we cannot. And that's a really critical idea. The second one, I think, is just falls in the category, I guess, of self-care. As I mentioned, when there's change, there's usually some loss. And when there's loss, there's usually some grief. And I think it's important to really recognize those feelings, if it's sadness, if it's grief, and to really kind of allow yourself the process of feeling it and going through it. And I've learned from situations in my own life that there's no one correct way to do grief. There's no one length of time you need to mourn after a loss. Everybody has their own unique style and process to go through it. And so, but I think the key is feeling it and going through it. If there is any grief there may be other feelings too. Sometimes change involves excitement. Sometimes change involves other kinds of feelings that can be aroused by this kind of shakeup of what's going on, especially if it's a planned move, where it's a choice or some kind of planned change. Then that is probably easier to accept, but also carries its own levels of stress. So again, I think connection here is important, to really seek out friends, to seek out family where you can process this and stay connected and have a sense of continuity. One of the things that happens with change is that it becomes hard to find that level of continuity. So every day may seem a little bit upside down. And so I think anything you can do to create some structure. I like to do a little morning ritual of meditation and writing. And no matter where I'm at, I can be at home or I can be traveling somewhere, but my day starts the same way. And that kind of grounds me for the day and helps me really stay balanced. And I think we can do the same thing when we're in the process of change, where we can evaluate that. Push the fingers off. The other thing that we can do, by the way, in terms of self-care is professional help. You know, sometimes to remember that we don't have to do this all by ourselves, that there's people out there that can help us. A lot of times I've had clients, and I felt this myself, say, gee, I don't want to burden my friends with this. You know, they're going to get tired of hearing about this. I don't want to dump this on them. And I think in a situation like that, it's really useful to have a therapist. And as a therapist, dump on the therapist. I can give you that advice as one myself. But I think, yeah, to get that professional help. Then third is really monitor your thinking about the situation. You know, there's a concept in therapy that we call reframing, where we kind of take a situation and maybe look at it from a different angle or look at it from a different perspective. And I think one of the ways we can make a situation worse sometimes is what we call thinking errors. So, or cognitive errors, cognitive distortions. So these might be black and white thinking. You know, it's only this choice or that choice with no gray area in between. Or we might be prone to catastrophizing, where, oh my God, this is the worst thing that's ever happened. It's going to be horrible. It's going to be a disaster. And it may not be at all. It may not even be close to that. Jumping to conclusions, you know, based on this little bit of tidbit of information, we have the whole scenario planned out and how usually it's going to go wrong. So a lot of that, just to be aware of your own patterns of those thinking errors and how you might jump to conclusions or overgeneralize or catastrophize or minimize or rationalize. All those things are very useful to understand, because in a way we can kind of make it worse for ourselves by our interpretation of events. And then two more, and I guess this would also fall maybe in the self-care section, but that's to really stay in the present. And that's something we talk about a lot here. It's so easy to be pulled into the future, to be drawn back into the past. And I think if we can really focus on the here and now, it helps the situation tremendously. If we live in the future or spend all our time there worrying and have anxiety about what might be, it's going to really, first of all, affect our health, our quality of life, and as someone once said, you know, 99.9% of that stuff never happens that we worry about in the future. The same thing happens, by the way, with the past. We can get drawn back, rehashing conversations in our minds, rehashing episodes. You know, if only I had ... And that also is a way to kind of just stay out of the present, and where we can really effectuate some kind of change or control. So I think it's really important to kind of stay in the present as clear as you can. And then one more, and that's to really, in the midst of change, to really clarify your priorities. It can be an opportunity actually to figure out what's important to me. You know, if I'm now faced with a choice of maybe dealing with different situations, how does this affect what is important to me, what I really want to do? How do I want to be spending my time? How do I want to be living? And oftentimes what seems like an unfortunate change, you know, losing your job or some other kind of a forced move across the country somewhere because of a partner, that might be an opportunity. So I think we need to kind of, again, reframe those and really try to recognize what might be in there in terms of an opportunity for us to take this change and do something more positive with it. So a couple tools there for you to work with. Change is just one of those things that is happening all the time. It does seem to be happening faster as well. But I think unless we learn how to really start to cope with it and manage it, it can truly be overwhelming and just exhaust us, both physically and emotionally. So with that, I'll turn it back to Scott.
Thank you. Good stuff, timely. You know, whenever we talk about change, I'm always reminded of the Serenity Prayer. You know, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And that prayer, if I actually take it as instruction, it kind of forces me through this process. You know, how much control do I have? The first thing you listed is the first part of the Serenity Prayer. You know, the serenity to accept the things I cannot change, which is almost everything. You know, the courage to change the things I can, which is, you know, me and my attitude and how I take care of myself in this moment, and the wisdom to know the difference. So yeah, I think this advice is great sobriety advice all the way across the board. So thank you. We've got a bunch of questions in already, which is very exciting. So I'm just going to jump into the questions. Here we go. Are there any meth antagonists coming down the research pipeline similar to naltrexone with alcohol? David, maybe you could talk about what naltrexone is, and maybe antabuse as well, and what the differences are, and then go to the meth antagonists.
Right. So yeah, for a long time for alcohol, there's been different interventions that are possible. Probably the oldest one that people know about is a drug called antabuse, which is given, and basically if someone ingests alcohol, if they're taking antabuse, they can have a really violent reaction and get very sick. And so the idea is to make it such an unpleasant and sometimes dangerous experience that people they choose not to use the alcohol. It's kind of it's a punitive, kind of a negative reinforcement, basically, for not using alcohol. In the more jump ahead 20 or 30 years, we have drugs like naltrexone, which found a starring role with a lot of opioid drugs from the opioid epidemic, where and then with alcohol, where it can really reduce the cravings that people can have, and it's found to be very powerful in terms of reducing those cravings and actually starting to block some of the effects of the drug itself, in terms of, similar to drug that reverses opioid overdoses, some of the same components. So those drugs are out there. There's been a lot of research and a lot of movement in those, and they've been amazingly effective for opioids and alcohol, as we said. To this day, it's been much harder to find something for the amphetamines. And as you've probably heard me say here, we have a bigger meth crisis than opioid crisis now in the United States. We have more overdoses from methamphetamine than opioid drugs. And meth kind of is the forgotten epidemic, if you will, except in certain circles. So we're really looking for something that will effectively reduce the cravings and help block some of the effects of the amphetamines. Interestingly, naltrexone, the same drug that works for opioids and alcohol, does seem to have some anti-craving effect for people that are using methamphetamine and other amphetamines. And a lot of people now, I'm seeing more and more meth clients who are being prescribed naltrexone by their physicians. It's off-label, it's not approved for that, but it seems to be effective for that. And there's also a lot of research now going into naltrexone combined with something else. Maybe they can up the effectiveness from 40% or whatever it is currently to a more effective by combining with another drug. So there's a lot of work going on. In terms of research, Columbia University is one center that's actively investigating drugs for to help with curb the impact of methamphetamine and the cues and triggers. What they're doing a lot of now is going back through old drugs that have been around for other things and seeing if they work. And interestingly, there are some drugs that show some promise. Wellbutrin, which is an antidepressant that works with dopamine, as does meth, seems to show some assistance in mild meth users. Effexor, an old atypical antidepressant, seems to have some effect as well. So all that's happening, and I know there's some work being done with novel kinds of substances as well to see if that can work. So all that said, there's a lot of research, there's a lot of interest. So far, no magical potion, but certainly there's some things that have promising signs.
And all of these drugs that have promising signs have to be taken according to plan, number one. Because they can all become drugs of abuse. I think we need to state that. And they work best in conjunction with 12-step recovery therapy, other things. They work best when they're not the sole means of staying sober. You know, naltrexone plus willpower.
I think they're even approved in conjunction. Right.
Yeah.
Those drugs are approved, I believe, with counseling. That's how they're, yeah.
Yeah. Good. Is the book Out of the Doghouse appropriate for a spouse who supposedly wants to work things out, but doesn't seem to be in active recovery? He has never admitted to me that he has a problem, only that he quit drinking and porn and started therapy when it all became a condition of his probation. Interesting. Out of the Doghouse is a useful book for anyone who has cheated on a spouse. So yeah, I think it's a useful book, but you know, you seem to think he has more than a problem that goes deeper than just infidelity. And if he's on probation and he has quit drinking and porn as conditions of his probation, perhaps he does. David, thoughts?
Yeah, by the way, Out of the Doghouse is Dr. Rob's, one of the Dr. Rob's books, and it's a really wonderful book that is really helpful for those situations. But I think what an essential precondition of that is recognition that there's a problem, and then interest in getting into really honest recovery, because it's hard to come out of the doghouse if there's still secrets and other kinds of behaviors going on that are really not conducive to healing. And that's the whole point of that. And so, yeah, there's a lot of red flags here in terms of admitting a problem, only doing certain behavior change under kind of duress. So yeah, I think that really needs to be looked at. But in general, Out of the Doghouse is a fabulous book that really provides very useful, kind of helpful, concrete steps for people to understand what's going on. So I highly recommended, but it really does work when there's recovery present, not so much otherwise.
Yeah, it's kind of like naltrexone. It's all by itself. It's probably not going to fix much, but it's useful. And this, you know, not everybody who cheats, by the way, is a sex addict. And Out of the Doghouse is a really good book for non-sex addicted men who've cheated. That really is sort of the plan. If there's sex addiction or other addiction in play, that will have to be addressed. Are there certain kinds of traumas and abuses that make sex addiction, I'm going to change this question a little bit, that make sex addiction more likely? I just added that, and or harder to get over.
Yeah, so of course there's all kinds of traumas and abuses, from physical to emotional to sexual and even neglect. And we find basically that most addicts, sex addicts or not, have some kind of traumatic history. We do find also that there's often a lot of sexual abuse that happens. And I had to go to Scott's point there. I think often there's sex abuse, sexual abuse in one's past, then that makes it more likely that there might be some sexual abuse acting out. Same with offending behavior, by the way. And so I think that, which is very different from sex addiction, the two unrelated things. But it's important, I think, to understand the role of trauma, in that it does set up the potential for reworking old wounds and traumatic repetition and these other things that we see happening. Trauma is treatable. That's the important thing here. Trauma can be treated with a variety of therapies like EMDR or hypnotherapy, and a lot of them. I think the best ones involve some kind of somatic component, meaning that they recognize the role of trauma both in the body and the mind. So we know that trauma kind of almost moves into the body's nervous system, if you will. There's memories of trauma that are physically held that also need to be released through work, and that can be with pressure points or other kinds of things that can help release that. So it's a very specialized kind of therapy. I think it's important to find someone who's certified in whatever trauma therapy they're working in. I think, to your question, I think sex abuse probably complicates things down the road in that regard. And by the way, I think if we talk about things like enmeshment and poor boundaries, so sex abuse may not always be overtly or explicitly sexual. It can be kind of boundary crashing and terribly inappropriate in more subtle ways. But we can also see that kind of spelling out into trauma as an adult, or PTSD.
Yeah, Paula Hall in the UK, who's a sex addiction therapist in the UK, she did kind of a massive survey of self-identified sex addicts. And one of the things she found, and which confirms other research about addiction in general, is that trauma and abuse really greatly increase the risk for addiction and other issues like anxiety and depression and things like that, but especially addiction. And that certain kinds of trauma and abuse tend to show up with sex addicts, and David just hit on them. It's the covert sexualized abuse, the enmeshment, the boundary violations, and the overt sexualized and romanticized abuse that we tend to think about. David, where does I know at Seeking Integrity we look for these traumas, we uncover them and acknowledge them. But during, the 2 to 4 weeks that guys are at the treatment center, we don't really dig into the actual trauma treatment. We kind of back burner it. Can you explain that process and why it's done that way?
Yeah, thanks. That's a really good point. Right. So in my work as a therapist, not infrequently, quite commonly, I would get clients coming to me who had relapsed. They'd had a pretty successful recovery, but they relapsed because some well-meaning therapists they were seeing started doing trauma work way too soon. And if we think about addiction, it's a way of managing feelings by disconnecting from them or numbing them or detaching from them. It's a way of dealing with trauma, with uncomfortable feelings by kind of going into fantasy and into other areas. So it's really, you numb those feelings. And when we get into recovery from addiction, we are kind of taking away that coping mechanism. It's not a great one, it has consequences, but addiction can be pretty effective at separating us from our feelings. And if we take that away, suddenly all those feelings that we may have been saving or holding in reserve for our lifetime start to come up, and they're very strong. And some of them are painful, and especially this trauma, which is likely, some of those traumatic feelings come up. And if the client or the person who's newly in recovery doesn't have adequate tools to manage those feelings, they can just overwhelm the system. And so we're cautious about starting to do that kind of digging around in early trauma too soon. And guys typically are too soon, at 2 weeks certainly. Sometimes if people extend, we start doing the trauma work. I would say sometimes in the second month is fine, third month. What you want to make sure is that clients or you have skills to manage feelings, to help identify feelings, have a support system in place, have structure in your life to deal with all this stuff, and some basic tools. And once that's in place, then I'm more comfortable starting to proceed with trauma. What we do at Seeking Integrity, and both Karen and I, who are the primary therapists there right now, we are both certified in trauma therapies, EMDR particularly, and we do what we call resourcing, which is where we help clients, we give clients tools, some of the tools I was speaking of, to manage their emotions, or there may be some breathing techniques or ways to kind of do a relaxation in your mind, or a safe place exercise, or even some tapping. All these different things clients can start to learn to manage their feelings. And we do start to do some of that so that when they're discharged, they're ready to really dig into that kind of second phase, which is the trauma work.
Thank you, David. This is from a sex addict, married 30 years, discovery 2.5 years ago, separated for it looks like the last 1.5 years. He feels pretty good about his sobriety. He's had a few slips. He's seeing a CSAT. Feels like he and his wife are trying to get together. I'm assuming this is the male addict and female trade partner. I apologize if I'm wrong. But they're trying to get back together, but the relationship feels stuck. The addict says, "I lied during disclosure, and understandably, okay, I did get it right. My wife does not trust me. How can I/we get unstuck? My spouse is currently not seeing a therapist." So 2.5 years from disclosure, or from D-Day, lied during disclosure, relationship is stuck.
So I'm not surprised that the relationship is stuck, I think, because for those of you that don't know, by the way, disclosure is kind of a very formal process where the addict presents to the partner basically a summary or what they've done. They disclose their behavior so that there's kind of a fresh start, a clean palette, a way to kind of clear the deck and start over. And of course, if you're not honest in that disclosure, it really poisons the ground there for future work and trust. You know, to get unstuck, I think there has to be truth has to come out. I think this would be a lot of honesty and truth, and working on that kind of communication. I think until that level of basic communication and unfortunately some degree of trust is reestablished, it's going to be hard because relationships are stuck because people get bogged down and there's a lot of defenses and a lot of things that aren't being said. Probably a lot of anger, a lot of unexpressed feelings, or maybe it is being expressed. So there's a lot of stuff kind of weighing down this relationship, I think, keeping it out of motion. And so therapy would help. I would recommend both parties getting a therapist and a separate therapist. I think it's important that your spouse has the support as well, and that you have the support. Partner trauma is a very real thing, and it's a specialty, by the way, and really need somebody that understands it and is proficient in it. But I think therapy could help, but therapy is not magic. And I think unless there's some kind of reestablishment of integrity and common ground where you can have some of these tough discussions, it's going to be hard. So I guess a therapist could guide you during that process, but you need a way to kind of have that fresh start again, and that's going to be tough. Some people do this with lie detectors and that kind of thing to give an extra layer of reassurance. But to me, the main issue here is that there's a whole bunch of feelings in your relationship that are weighing it down. I think that some of the anger and the lack of trust and fear, and no doubt resentment and all kinds of other things that really need to be expressed and released.
Yeah, I agree completely. You know, the purpose of doing this formal therapeutic disclosure is to get everything on the table so that the betrayed partner knows everything and can make decisions based on that, and you can rebuild trust. But, you know, a botched disclosure, it's really tough to overcome, because this process that is supposed to get all of the truth out, so, you know, so that you can start over and rebuild trust, you know, if there's lies during that, that's a tough one to overcome, and it's going to take a lot of time and effort to re-earn relationship trust. So yeah, I'm going to pull this one out of the chat feature. It came in early, but it was in the chat feature, but I wanted to address it. What is your advice regarding tracking my partner's whereabouts? I have a tracking device that I've been leaving in his car. He knows about this. I used to check that on my iPhone, and he willingly let me do it. But I discovered that he was, so it must be his iPhone that has the tracker. I discovered he was leaving his phone in the office and then going to act out. I found out about his last relapse thanks to the GPS device. Okay, so there's phone tracking and GPS in the car. And he was leaving his phone behind, acting out, but got caught because of GPS in the car. Do you consider this snooping? I don't look into past things anymore, but it's very important to me to know that he's not acting out now. Thank you very much for the webinars and the chance to ask questions. You're very welcome. Is that snooping, David? Is that crossing a boundary?
To me, it can go both ways, and that kind of behavior. And what I mean by that is there's the whole issue of accountability, right? Where we want people to know if I'm an addict in recovery and I tell my husband or my wife that I'm going to be somewhere, it's appropriate that he be able to check on that and know that I'm doing what I'm saying I'm doing. And so some couples do that by agreeing mutually to have this tracking ability where someone can check if they want. I mean, those are part of kind of the discussions of boundaries that a couple has to talk about and see what's comfortable, what feels safe, what's going to be enough information to help that partner feel safe. It can get extreme, and I think one of the things we know about partner trauma is that there's a strategy the partner wants to feel better, and there's, I think, a mistaken belief that if I have more information and more data, then I'll feel better. That will reassure me. But the problem is that seems to be a bottomless pit. There's never enough information to really be reassured. And so I have seen where it got totally over the line in terms of snooping, for a nice word, I guess, where people were, planting devices and secretly monitoring, I guess. And that's just not okay for all kinds of reasons. One is that it's not going to help. The partner's not going to be reassured. It really violates trust, if you will. And I know trust is an issue here, but it also really crosses a boundary, I think, in terms of just even the addict has some right to privacy I believe, and they need to be accountable, they need to be transparent, but I think they also, unless it's talked about and negotiated, have the right. That's my opinion. You may get in trouble for that, but I think sometimes I've seen partners, in an effort to be reassured, just go way over the boundary with secret filming and people being followed and secret devices. And by the way, I think that just is making the partner crazy, because it's a lot of effort, it's a lot of angst, and a lot of anxiety, frankly, stirred up by the whole process. So, Scott, I'd be curious what you think on that.
Yeah, Michelle Mays, who's a therapist on the East Coast, she writes a blog called Partner Hope. I read it religiously. You can subscribe to it. I highly recommend it if you're a betrayed partner. She talks about Sherlocking, which is, all of this sort of going through the wallet and the receipts and the text messages and the phones and the trackers and the this and the that, and it can go overboard. Now, that said, betrayed partners have a need to feel safe. And that's why you ask for things like trackers, and I can track you on your iPhone. You've got one in his car as well. I don't know if he knew about the one in the car. I'm guessing he knew about the one on the iPhone. It's better to be upfront about these things, but at the same time, you have a need to feel safe, and I want to validate your need and desire to feel safe and to know what's going on, especially right now. Now I want to add the thing that I get from the addicts that I talk to is, gosh, she's just going overboard. She wants this and this and this and this and this and that and this. And my response is, you want to save your relationship? Well, yeah. You want to rebuild trust? Well, yeah. Then what are you hiding? Let her, become transparent. Show her all the money. Show her, let her do the tracker on your phone and your car, and let her do what she needs to do to feel safe. So that's the counter of this is addicts. You need to let your betrayed partner have this information. And if you're keeping secrets, it's on you. And if you get caught, it's on you. Whether she's snooping or not doesn't really matter. You were sneaking out at lunch and acting out and not telling her about it. So that's, I kind of agree there's a limit to this, and everybody deserves some privacy. But at the same time, when you cheat, you kind of forfeit some of your right to privacy after that until your partner begins to feel safe again. So it's a really fine line that we have to walk. So I don't know if I agreed with you or disagreed with you or restated you.
Oh, that makes sense. I was trying to articulate that. You did it much better.
Oh, well, thanks. Just wanted to thank you for your service. Thank you. You're welcome. You asked a question last week. Oh, I remember this question. Your husband's birthday, your sex addict's birthday was Saturday, and he had agreed to work, and you weren't comfortable with that. You were worried that was an old pattern. We suggested that maybe he check in while he's at work and send you his location and things like that. You asked for that. He did not argue. It went, well, thanks. Okay, you're welcome. We gave some decent advice.
Perfect.
We hear different statistics as to which percentage of addicts are able to heal and stay in recovery from their addiction without relapsing. I believe Dr. Rob says 80% of those who go through his facility are able to recover. Do you agree that this percentage, not necessarily for those going through seeking integrity, but for addicts in general? I'm going to let you take that question, David, because there's a lot of variables in it that can change the answer.
Yeah, I don't know that number with Dr. Rob, but in general, let me talk about recovery statistics, because I know it's obviously something you want to quantify the possibility. And the problem, it's almost always comparing apples and oranges and carrots and watermelons, because the definitions of what recovery is can vary. The length of time in terms of those definitions can vary sometimes. There's just a lot of factors that are hard to say. And so I think it's really hard. I know with drug abuse, and I don't know the sex addict numbers, but the drug numbers, they can range from, I do a lot of work with methamphetamine, and if you look at some statistics, it says, 2% of people recover from meth. Well, what does that mean? Because does that mean from the first time they go to a meeting, they never relapse again? Well, that may be true, but there are a number of people with meth and with other drugs and with sex addiction, for that matter, who go and then may relapse or slip and go and relapse and slip, and eventually a lot of them get it. And so it depends on how you count. Are you counting from the very beginning, or from the number of slips, or from the last slip? But I think if you take into account that it's a rocky road, whether it's for amphetamines or sex addiction, and if people work their program, and that's the other, maybe the criteria here is that what level of intervention are people continuing to do? Or how many meetings are they going to? Do they have a sponsor? Do they have a therapist? Have they worked the steps? All those are also variables. So I can see where a number of 80% in my mind would be totally possible if we're talking about understanding that that's not from the first day someone ever goes to a meeting, but really over the long haul, where they get some long-term sobriety, start to put together years. And there is a point for alcohol. I don't know, if, Scott, if it's been validated, but I believe in AA, there's a certain point you reach, and after that, your chance of relapse goes way down. I mean, there's a safety factor, and I assume that's true of all addictions.
It's the 1 year mark. If you make it
Just
past your 1 year birthday from alcohol, the odds of staying sober the rest of your life go way up. But yeah, and I assume other addictions are like that. But yeah, how do we define recover? It took me 2 years to get some sobriety, but I've now been sober from all of my addictions for 16, going on 17 years. I consider, that good, solid recovery. I consider that a success. But the first couple of years of me in recovery, I was learning, I was slipping and sliding. I was doing exactly what David described, and that would call me a failure. But, it's difficult to measure, because, would have to be a super long-term study. Yeah. So, yeah, difficult. Why do people say that?
I wish I could answer with more specificity. But
yeah. We would love to have numbers that are, well-defined and easily studied, and we don't. So why do people, I love this question. Why do people say that going through sex addiction rehab ruins the addiction for the addict? In what way is it ruined? Thank you. You want to take that, or you want me to?
Go ahead. Why do you take that?
I'll do it. I'll use alcohol as the example. In alcohol, they say there's absolutely nothing worse in life than a belly full of booze and a head full of AA. You cannot enjoy the booze when you know that you're an alcoholic and you're ruining your life when you drink. Sex addiction's the same way. When I know that I'm an addict and I know that it's created massive consequences in my life, it's really hard to enjoy addictive sexual behavior after that, because I know I have this nagging little voice in the back of my head saying, don't do this. This is a bad idea. Oh, you shouldn't, you're going to regret this. Just nonstop nagging at me, because I now know the truth. I have broken through my denial enough that I know that this is just a really bad idea. So, anything you want to add to that, David?
Yeah, just the same thing, that there's always that kind of nagging voice, and you kind of know what you're doing, but it's that addictive impulse is kind of driving your actions anyway, but you're not really enjoying it like you think you would, like the fantasy tells you as you remember it, but it just never quite works out. So I think, yeah, it's totally the same with most addictive behaviors or drugs.
So if either of you is comfortable answering this, do you take psych meds? And if so, how has it helped you? And what side effects have you experienced? I'm afraid of them, so any experiences, positive or negative, would be great. Thank you. David, maybe you could just address like psych meds and recovery in general a little bit too.
Yeah, so this is important. You know, I've been around AA long enough to remember when, if someone was on an antidepressant, in some meetings, they would be kind of called out on and said they weren't really sober. They weren't really in recovery because they were taking these medications. Hopefully we've advanced a lot since then. There are people whose lives, people who are alive, first of all, because of psychiatric medicine, people whose lives are certainly much improved because of psychiatric meds. So I think they're an important factor. Do some of them counteract some of the benefits of program? You know, there are, I think if we think about the benzodiazepines and all the kind of anti-anxiety drugs that are highly addictive and to which a lot of people get addicted, you know, those are not appropriate and probably not considered psychiatric actually. But the psychiatric meds that are the typical antidepressants that we see these days, many people are familiar with SSRIs, the Prozacs and the Celexas and Cymbaltas and that whole family. They've been around a long time. They're considered very safe. They're very practical because a general practitioner can prescribe them. You don't have to see a psychiatrist, and they sometimes really help. And we know that with addiction, oftentimes, especially in the beginning, there is kind of a depressive component to it. And sometimes we don't know what it's going to be when we get into recovery. So I don't necessarily think everybody has to have them, but I deal a lot, as I said, with methamphetamine, and their brain wiring, if you will, is really damaged at first. It comes back in recovery, but there's an inherent depression that goes with early recovery with meth to the point where it really interferes with their ability to stay sober. And in those cases, an antidepressant works really well to just keep the bottom from dropping out from under people. So, I think they're not necessarily something to be afraid of at all. I think I will say that in my experience, not every drug works for every person. It may be sometimes a very frustrating trial and error to find an antidepressant, even other SSRIs that work for you. But if you can get a good practitioner, and I think it's good science and it's a little bit of artistry too, they can really read you and help you, then I think they can really be beneficial and totally help your recovery.
And then on top of that, you know, if somebody is bipolar or has a real psychosis, that they take your meds. But usually the question is more about antidepressants. You know, my doctor says maybe an antidepressant will help. You know, maybe it will, maybe it won't. You could try it. Yeah, don't let anybody tell you you're not sober. If I may add to that, Scott. Go ahead.
Yeah, but I was also, sometimes we see a lot of people coming in who have been in the throes of their addiction, kind of acting out, acting erratically, and they've been diagnosed with a mental illness, and often a very serious diagnosis, schizophrenia or bipolar, and prescribed really heavy-duty drugs. And so I think, you know, we don't want to just take everybody off everything, but I think it's really important if you've had such a diagnosis in the middle of your addiction, then I think it takes some very careful evaluation once you get into recovery, because a lot of those symptoms may change.
Yeah. And you know, I'm a big believer in, as a nation, we are seriously over-medicated. And I see a lot of addicts getting diagnosed. I consistently see addicts getting diagnosed with things like bipolar disorder. And then they get sober and they're not bipolar. It's just in their addiction, particularly if they're doing something like meth. An addiction can make you look like you have a serious disorder. So you have to be careful. But yeah, things like depression meds, SSRIs are pretty useful for a lot of people and pretty benign in terms of, you know, side effects and things. I don't know. I hope we answered your question. Be careful, but don't fear them, I guess, is my advice. First of all, thanks to both of you for always being such a warm and comforting presence. You're very welcome. I'm a grateful recovering sex addict with a childhood history of violent physical and emotional abuse by parents and 4 years of sexual abuse by Clear Jam. Sorry to hear that. I find my healing stalled on one aspect of my childhood that feels deeply programmed. All failures of any kind were punished violently, and if I expressed any need that involved money, I was berated for causing the family undue monetary stress. I feel programmed to never fail, and I never ever advocate for my needs. In therapy, I'm told to have compassion for that little boy, but I feel so powerful that this is that boy being too much trouble again. It feels like this boy is being a pain in the butt again. It feels like I'm trapped in an infinite loop, and I come out bitter at the world. Do you have any advice for breaking this cycle? Thank you for asking this question. David.
Yeah, and I'm so sorry for your experience and what you've gone through and your obvious efforts at trying to move past it. So this would be what we call complex trauma. It's long, it's intense, and enduring and extremely damaging. And so it's a really horrible thing to have happened. And the way the brain works is that it starts to associate these things, these behaviors, where it reminds us. You say you've been in therapy, but I love, by the way, the idea of an inner child working with your inner boy, that kind of wounded inner part of ourselves that we all carry around. I think it's just really important that your therapy is a trauma therapy. You don't mention that it is, but this would be the kind of intervention that would be most helpful for you, is to work on that trauma. You're having a lot of trauma repetition. When those things happen, you're kind of re-experiencing your reaction as if it were years ago. And that's PTSD, that's post-traumatic stress. And that can be treated with trauma therapies. But I think it's really important to have somebody who is attuned to that and aware and certified and all the credentials to work with this, because you're a complex case with this really deeply rooted abuse that you endured. And so I think making sure you have someone doing trauma therapy, and one of the reasons I mentioned that, by the way, there's regular therapy is often considered talk therapy, right? And we have different ways of doing it. Trauma therapy, we discovered kind of the hard way, you can't just do talk therapy for trauma, because trauma, as I mentioned earlier tonight, it gets hardwired into our body's nervous system. It's held in our bodies. If you ever had a massage and somebody hit a point and you started laughing or crying, those are kind of the feelings that are trapped in our body. So it's really important to have somebody who knows trauma therapy. And trauma therapy then is not just talk, but it also involves the other part of our brain, the kind of nonverbal part that's extremely important to move past this. So that's my 2 cents on that. I just think there's a variety of trauma therapies, EMDR, hypnotherapy, different somatic therapies. There's a number of them, but do talk to your therapist. And if he or she is not a trauma therapist, I'd really discuss maybe possibly getting a referral for that trauma work.
Yeah, thank you, David. I just put links to Bessel van der Kolk's book, The Body Keeps the Score, and Eddie Caparucci's book, Going Deeper, in the chat feature. Those are amazing books that really, particularly van der Kolk's book, really kind of explains the process. And Eddie talks a lot about the inner child, so his book is great in that respect. Highly recommend both of those. And
if you're interested, I have a podcast with Eddie on my podcast series at Sex Relationship Healing. You can find that.
Yeah, that's good. As a matter of fact, I'll put a link to that as soon as I have a moment. My husband was diagnosed as a sex addict. How do I know if he has intimacy anorexia as well? He had problems having sex with me, but did not seem to have issues with other random people. Common issue, good question. David?
Yeah, so where to start? So we tend to think at Seeking Integrity of every sex addict having an intimacy disorder as an attachment disorder. And what do I mean by that? When we our early young children, the most important relationships at the time, and really in terms of our development, are the relationships with our caregivers. They're typically parents or whoever's caring for us. And depending on the quality of those relationships, how consistent they are, do we get positive reinforcement from those people? Do they act erratically? Are they even there for us? All those things help us form these patterns that are lifelong in terms of how we relate to other people. And it comes down to trust and how much we can be vulnerable and all these issues that directly translate into our ability to be intimate as adults. And so, and there's different styles of attachment, but I think most, if not all, sex addicts have at least some kind of dysfunction in these early attachments. Often abuse, which will certainly do it, but neglect, enmeshment we mentioned earlier, where there's no good boundaries between mother and son or father and daughter or parent and child. So it can be intimacy disorders are very much a part of the game. The other thing you mentioned, where he has problems having sex with me, but not issues with random people, we do see in sex addiction and also in chemsex addiction, with the progression of the addictive behavior, this kind of separation of what I call lust and love, where if there's someone we have an emotional attachment to, ironically, it's hard to have an erotic appeal there, but we can be aroused by people that we have no emotional attachment to. And that's not so much a characterization of you, but of the process of sex addiction, which is all about objectifying. And so far, in fact, an emotional entanglement with a sexual object, if anything, kind of complicates it, or I think people want to live in the fantasy with sex addiction. And so they objectify people and kind of as elements that they bring into their head as a fantasy. And so with time, those two things separate. And so you have a deep emotion, you can have a deep emotional connection, but have a real sexual problem. And that's, I think, where a CSAT would be helpful, or a sex therapist would be helpful to help bring those back together. Because a couple can re-engage those, but it takes some time and some work and some specialized therapy, I would say.
Yeah, this is interesting. I had a long call with a friend of mine today who's kind of going through this, and he's the addict, and he and his wife are having trouble reconnecting sexually, and it was an interesting conversation that deals with a little bit of this. But Patrick Carnes, who's sort of Dr. Rob Weiss's predecessor in the sex addiction field, did a study about 20 some odd years ago, looking at sex addicts and sort of traits and characteristics of sex addicts. And one of the things that he found is that sex addicts are kind of really bad at sex, particularly with their own personal one romantic partner. And we could get into the whole brain chemistry intensity issue that we see with porn addicts. Porn addicts, there are 16-year-old porn addicts who have erectile dysfunction with their girlfriend. They're fine with porn, but they have ED with their girlfriend. They're 16, 18, 20. I mean, this is not an age or a physical thing. This is a mental thing. They've become so accustomed to the intensity of the addiction that one person can't provide that intensity. But yeah, there's the disconnect and the inability to connect intimacy, physical intimacy, with emotional intimacy that sex addicts have, and that can be a problem. And did you mention Masters and Johnson and some of the exercises to work people through that, or?
No, I mentioned there's therapies that do this. One very common one that people can actually Google is by Masters and Johnson, the famous sex therapy couple, who created this technique called sensate focus. It's really an intimacy kind of communication exercise for couples. Scott, can you put that in the chat? Because it's always a name that people can't spell. Sensate focus. What it basically is a series of giving and receiving that a couple has. So the giver, the pleasurer, and it's not a sexual exercise initially. It's the pleasurer will be guided in their hand. They'll touch, they'll massage, they'll pinch, they'll stroke, whatever to their partner. It's a nonverbal intimacy communication. Remember, not sexual, but really discovering with the partner's guidance what's appealing to them. And then you flip, you do the reverse. So each partner starts to learn in very nonverbal ways all these intimate points that their partner, and often things they didn't know about before. And it's just a nice way to reestablish that contact that's been lost for a while. And then often, inevitably, it becomes sexual in the first one, even though it's not supposed to, but then it becomes sexual down the road. But sensate focus is a really powerful exercise.
Okay, let's squeeze in one more. I've heard that Remeron is the name, has some success in limiting the effects of meth. Have you heard of this? I'm sure you can actually pronounce
it. Yes, I have, and you're right. Mirtazapine. Yeah, it's an atypical antidepressant. It has been shown to be helpful in reducing cravings among mild users. So if you're kind of past a certain point, it didn't show any effectiveness in your use. It didn't show any effectiveness at all. But for people that were like occasional people who users who wanted to kind of cut back, it really helped them cut back and reduce the cravings.
Thank you, David. Thank you, everybody, for being here, for your wonderful questions. We have a bunch of questions left, and we just don't have time to get to all of them. So please save them, bring them next week, type them in early, and that way you know we'll get to them. Thank you. We'll be back next Wednesday. David, anything you want to say to take us out?
Just thank you for your active participation tonight and great questions, and we'll see you next week.
Good night, everybody.